Hello, if you are a woman who is in her late 40s or early 50s and has menopause and is having spotting or bleeding per vaginum, then you must watch this video. Hi, I am Dr. Srinivas Rao, gynecologist and gynec oncologist from Ayansh Hospital, Indiranagar, Bangalore. Indian women tend to menopause between the ages 47 to 52. Some women who may continue to menstruate till the age of 55 should definitely be investigated. But after menopause, wherein the ovarian function has completely stopped, the inner lining of the uterus, that is the endometrium, which has stopped reacting to the hormonal actions, and if this woman has any kind of bleeding per vaginum, then she must as soon as possible contact her gynecologist. A woman should not bleed after she has attained menopause, but sometimes this symptom develops in women. The commonest cause is that the endometrium is too thin, known as atrophic endometrium. When you meet your gynecologist with this symptom, then he or she is likely to conduct a full detailed examination, general systemic and local examination. Thereafter, he or she would conduct a pelvic ultrasound scan to see the size of the uterus and the endometrial thickness, the echo texture, if there are any lesions in the cavity. The gold standard for a woman who has postmenopausal bleeding is to undergo hysteroscopic examination. Now, hysteroscopic examination means a telescopic examination of the inside of the uterine cavity. Now, this is performed under general anesthesia. There are times when this procedure is performed without anesthesia, which is known as office cystoscopy, but it has its own limitations. It is usually a daycare procedure. The inside of the uterus is studied with the hystoscopy. During the hystoscopic examination, you may find nothing abnormal with a thin endometrium, or you can find a thick, variegated, polypoidal type of endometrium, which we can take a biopsy, then send it for microscopic examination and treat accordingly. Sometimes benign polyps are seen, which can be removed in the same sitting and cured. Sometimes, rarely, endometrial cancer can be detected by using this method. A woman who has experienced postmenopausal bleeding should immediately contact her doctor and get the matter resolved as soon as possible. If you have liked this video, please share so that maximum number of such women benefit from this information. Do like and subscribe and watch the space for my next video. Thank you.